We've developed a product called ResPerTap, and we're very excited about it. It's a very simple tool used for respiratory therapy to loosen lung secretions in patients that have problems mobilizing secretions. My partner, Diana, is a respiratory therapist at a major children's hospital, and Diana had told me that when she was at the hospital, they really were struggling because they didn't have a product that could help mobilize secretions that was simple, easy to use, cost-effective, was sterile or easily sterilized. Why isn't there something out there that does this?
ResPerTap is a device that basically takes a cup, and we all in my profession use these cups to do this percussion therapy. We've developed something that will percuss and tap and is actually easy to use.
I do have a daughter who has some respiratory issues. She's just turned 10 and has had multiple hospitalizations for pulmonary issues. It can be terrifying when they can't breathe and their SATs won't come up and you just don't know exactly what to do. What we use at home has been these mostly made for us by the RTs in the hospital, and we've taken them home with us over the years. But they do pop and lose their puffiness and comfort and usability after a while, because you really have to get in there and get working hard with these.
It's a pretty common occurrence out there that hospitals, the nurses and the respiratory therapists, they're gathering up whatever they can to do this treatment that needs to be done. My passion came from my issues in taking care of these people and wanting a better option.
What we came up with is a couple of different tools. This one is for pediatrics. So we need something that's got a small head so you can go to specific lobes of the lung and try to loosen secretions. At the end, it will have a disposable cup that you will actually push in there and turn, and that's the part that can be replaced with each patient. The rest of this is a durable piece of equipment that the respiratory therapist will use from patient to patient. It can easily be wiped down with alcohol and disinfected.
It's like this amazing piece of equipment because with just a simple motion, you get more range. And we've looked at different weights for different sizes for the handles to use with these different heads. And so you get different percussion pressures.
If there was a tool like this that would be great, that would be easier to use. It doesn't take much work and it's doing the work pretty much for you. So it is better to know that there is something designed specifically for this purpose that is made with the safety in mind. This one with the hard edges and the thing that sticks out the bottom, if you're not paying attention and it gets folded up in there, can cause bruising and issues. And if you hit too hard with this, even when it's inflated, it can definitely leave marks and bruises, which we've had as well with my daughter.
I think if the caregivers and the respiratory therapists and the nurses and the doctors, if enough of us could come together, or if we found one person who was willing to support us, that we could take it to the next step. And we're looking at about $50,000 to make enough models to put in the hands of clinicians to FDA trial it, to fine tune it, and then beyond that, it'd be probably another $500,000 to go to production.
Because we're patent pending, we can make prototypes and we can distribute them after we get those prototypes in the hands of caregivers and some professionals that can use them and try them out. Then we'll be able to start distributing these to hospitals and to caregivers around the United States. And that's our goal.
When these are available, I'll be first in line to get one. I'm very excited to see being used and being able to learn and explore them ourselves and have them at home. So hopefully we can keep on top of all these issues that arise with her. But I think it would be beneficial for a lot of families with kids like Gabby, just even to have in those acute settings that would be easy to use and to maintain for these children who end up having a lot of complexities.
The bottom line is, and this is what matters to me, is that we can get it out there and people can start benefiting from its use.
This is something that they're dealing with every single day, multiple times a day. And if we can do this one thing that's going to change the quality of their lives, then that seems like it's a pretty important thing.
That's